3rd grade when invariably the teacher's technical stuff didn't work, and some student had to come out and try to help out. So I thank you all for your patience, and I think we'll just try to see if we can get going here. Again, I want to thank you very much for the lovely introduction. I'd like to talk about the goals for today. This is a topic that a lot of people may not be very aware of, and it's really cutting edge, so I appreciate everybody's willingness to learn a bit. It is an hour-long presentation, so we have some limitations there. Whoops, we just went back. So we're going to learn about some of the basics today about the endocrine system and the hormonal system. And it is a basic presentation, so keep that in mind. I am looking at what the physical as well as the mental health symptoms are that can indicate an endocrine system disturbance. And I will also let you know that I'll use the terms hormonal and endocrine somewhat interchangeably. The hormonal word is more generic and something that most people are more familiar with. Endocrine is a more medical term, so, just so that you're aware of that. We're also going to look at how can hormonal disorder affect marital, family, and social relationships, and also some tools for all of you and limits within the mental health clinician purview. And my screen, there we go. There's a quote from a Dr. Harvey Cushing. It's quite probable that the psychopathology of everyday life hinges largely upon the discharge of the ductless gland upon the nervous system. Now, what's important is Dr. Cushing said this in 1913. This is a slide that is a basic representation of the endocrine system. You can see if you start from the top of the head, and actually it's not in the brain, but it's just below the brain. If you see the pituitary gland there, the hypothalamus, the pineal gland, and then going down into the thyroid. Many people are familiar with thyroid gland issues. And then all the way down into the stomach, the gut area has a lot of endocrine receptors, and then the reproductive system. So it's pretty much of an entire body system. This is a little bit closer view within the cranium. If you look at the pituitary gland sits just at the base of the brain. And because of its location, I look at the pituitary gland. It's often called the master gland. And the Mother Nature, I think, is a lovely model for designing our bodies. If you think about our heart is encased by our rib cage, and then the sternum kind of protects it very much. I think that says that obviously it's very important. Our reproductive organs are kind of encased in, with our hip bones and within a lot of other structures around there that says that those are very important. The pituitary gland sits inside of this brain, or this casing around the brain, and inside of, just underneath the brain is a bony structure, and inside of that bony structure, almost like another cranium, sits the pituitary gland. I think that's Mother Nature's way of saying this is a very important part of the body. If we look at some things that can go wrong with either the pituitary, primarily the pituitary gland, a cyst is considered something that's filled with liquid or fluid. Something called a Rathke's cyst is real common, and you'll get a headache from that. And even with when it is surgically removed from this area, they about 10% of the time will reoccur. So it's a pretty significant thing. A tumor is considered a dense mass, and then an adenoma, which I will talk about a little bit. An adenoma is a kind of a tumor, but it isn't a spreading tumor. It's not the same as cancer. A cancer will spread, but an adenoma is just a mass. And in and of itself, it may or may not do damage. It really kind of depends. So we're looking at, and hopefully some people have heard more recently about the HPA axis. We're talking about the hypothalamus, the pituitary gland, and the adrenal gland. The hypothalamus sits above the pituitary. It's very tiny, and then it connects and talks to and sends messages to the pituitary gland. The pituitary has 7 hormones that it produces, so it's pretty densely concentrated on a variety of different hormones. Depending on, let's say if somebody has a growth on the pituitary gland, it may depend on where on the specific part of the pituitary. It has an anterior and a posterior section. It will depend on whether that tumor is either pressing on a particular section that might cause too much or too little of a particular hormone that gets secreted, and so therefore that would be an issue. The adrenal glands sit right above the kidneys, and they produce cortisol, and we'll talk a little bit more about those. So the endocrine system, I think of it kind of like a freeway system. In and of itself, the endocrine glands don't do anything just in and of themselves, but they help regulate processes within the body, throughout the body. Just as the freeway system, they don't really do anything, but they get us places. They get us to the end point. The hormones have specific end points within the body that then will act on those particular organs in one way or another. The other thing that's important to know about hormones or endocrine system, people will also often hear about a range. It's within a quote-unquote normal range. Most of the hormones have a reference range from 1 degree to another, low to high. And oftentimes I hear people talking about, oh, my hormones are good, or my doctor said I'm normal. Well, that's a real, it's a tricky kind of a thing to know about. First of all, our hormones vary throughout the day, all the time. They go up, they go down, and this is normal, and that's fine. And so to get a true range, you may get a particular number, but because it's in a range, they want to know, is it within something that's considered healthy? Now, depending on the range of the doctor's expertise, this is a very, very specific kind of medicine, endocrinology. Even not all endocrinologists are specialists within certain parts of some system disorders. So it's really kind of tricky, and some of these disorders that I'm going to talk about today, which are, and mostly I'm focusing on the moderate to severe kinds of things that can go wrong. Obviously, things like just normal adolescent hormones or menopause, those are within normal ranges, but I'm not going to focus today about that. It's more on things that can really go wrong and then particularly affect the mental health system. So let's look at what is the role of the endocrine system. What does it do? Well, first of all, it's part of our response to stress. It's a wonderful alarm system that's built within our body. I talk to my clients oftentimes, and it's real helpful when you're talking to clients about anxiety disorders, whatever, because I think personally that stress has gotten kind of a bad rap. I think that not all stress is bad. We need a certain amount of stress just to get going in the morning. Generally, about 8 a.m., all of us get kind of a boost of cortisol. That's what gets us awake, gets us going, presumably with or without caffeine. So we need a certain amount of stress. The tricky part is to have that within a reasonable range so that that it's healthy for us. And so the endocrine system interacts with all systems within the body. That's why this is so important. I think next to the cardiovascular system, next to the our breathing system, our lungs to get us oxygen, that the endocrine system is really, really very important. It helps us, our bodies, control growth and development. It helps us when we're children to grow normally, hopefully, when we're adolescents to grow into adulthood. And it also helps us to maintain just basic homeostasis in our bodies, physically homeostatic process. It helps with production, storage, and utilization of energy. obviously, which we need to be able to maintain health, in reproduction, and in birth and lactation. So the HPA axis also has an association with psychiatric illness when there's endocrine abnormalities. That's part of the reason for my writing my book, as well as trying to educate people about this. Very, very important to recognize that a major function of the nervous system is also to maintain homeostasis and the stability of the internal environment. And the hypothalamus, if we really look at if we thought back to that first or second slide about showing the brain, the hypothalamus is very closely connected to structures within the limbic system and right at the brainstem. And so it does have connections within the limbic system, and we know that the limbic system is part of our emotional response system. And I don't know if you guys are seeing this pop up. I hope you're not. I'm not real sure how to take care of that on my screen. So anyway, so if we're looking at what the hypothalamus and that connection with the limbic system do, they will help regulate body temperature. For women who are going through menopause, for example, it's the hypothalamus that is kind of going haywire when we're getting hot flashes. So we can blame the hypothalamus. During childbirth, with our emotional system, obviously, where mental health professionals are concerned, in growth and development, with weight. There are some early studies that were done with the hypothalamus that demonstrated that lesions on the ventral medial hypothalamus produced hyperphagia and obesity, meaning overeating. Very interesting. And sometimes some of these studies have only been done on brains because there's been damage that they've actually witnessed or been able to see the after effects. And then we realize that because this is where the damage was, that this is the resulting behavior that is happening. So then it leads to more investigation of what the real causes are. For example, if you have a lesion on the lateral part of the hypothalamus, it often leads to starvation because people have a difficulty swallowing. Stimulation of this opposite effect on these lesions leads to a theory that the hypothalamus has something to do with the feeding center or the satiety center of the brain. So when we're looking at eating disorders, that sort of thing, this may be something that we really need to be looking at even further. The hypothalamus connecting to the limbic system helps regulate sleep, that salt and water balance, as well as milk production, which after birth happens. Other things can negatively have an influence on HPA other than classic endocrine disease. There are disorders and illnesses that can, so it's not specifically due to lesions. So how prevalent are pituitary tumors, for example, or I'll call them adenomas? Again, if you recall an adenoma is a non-cancerous tumor. A lot of times when people hear non-cancer or the term can be used as benign, a lot of times it's okay, it's not a problem. But in this case, benign only means that it's not growing. We have very many studies. One that was predominantly done in 2004, Clinical Congress of the American Association of Clinical Endocrinologists, very prominent study that shows that basically 1 in 5 adults have a pituitary tumor. I realize that this may sound very bizarre. Now, about a third of these, again, we don't know exactly, but about a third of those, 1 in 5, are considered clinically significant, meaning showing some kind of health, and I'll use mental health risks or disorders that are significant enough to show treatment. So we're really looking at a lot of people. Pituitary tumors take up about 33% of all brain tumors. So it's fairly common. Pituitary tumors are far more common than were previously known. This study in 2004 was done, it was an autopsy study, And so what they did is they did a meta-analytic study of people that had died just for a variety of whatever reasons, did autopsies, looked at the brains, or looked at their skulls, and they found about 14 or 16.7% of all these people that had died had a pituitary tumor. And most of those have not been diagnosed as such, by the way. So it's estimated about 130 to 280 per million per year. A very small percentage are familial. Most of these are not genetically transmitted. Okay. Pituitary and neuroendocrine disorders basically affect three major areas. They're going to affect our sexual development and performance, psychological and emotional, and physiological. For example, if we look at just sex, if somebody has too much progesterone, which is one of the 7 hormones that are produced by the pituitary, if you have too much, too little, you're going to have a lowered libido. Significant effect. It has nothing to do with a relationship between the couple. It has nothing to do with trauma, emotional trauma, meaning, but it has to do with the hormones. Very high levels of progesterone, for example, cause females to be irritable, very aggressive, and even mildly depressive. The signs and symptoms of these, I'm going to break this down for a little bit, and again, I'm focusing on this for non-medical professionals. If we look at sexual issues or just behaviors that come from some of these disorders, the low or no sex drive that I mentioned before, menstrual changes. Now, I really want to mention something about menstrual changes. This is something that I've actually changed in doing the way I work and doing a clinical intake. In my book, I have a helpful, I think, chart that people can fill out, and I give it to all mothers of teenagers, and I give it to all my teenage girls, and it's a tool to help talk to them about their menstrual cycle. For example, about 15 to 20% of all women who have no menstrual periods, and there are, it's fairly common, have one of these adenomas called a prolactinoma, which is serious. It's very serious. Now, 15 to 20%, I think that's a significant amount. There are lots of reasons for having too much of a problem with your menstrual cycle, or too little or no menstrual cycle, but I think it should be considered next to heart rate, breathing temperature, basic bodily functions. It should be a discussion, and within the mental health clinical intake, just asking how are your menstrual cycles? Are they okay? Is it fine? Because again, it helps clients, I believe, to pay attention to their bodies. I also think it's really helpful for those that have a trauma background to be able to begin to recognize and be able to use words to talk about their bodies, because oftentimes, particularly with sexual abuse, it can be very difficult to even recognize bodily functions, and particularly something that has to do with sexual disorder or the sexual part of your body. But I think it's an important part to recognize the biology. For men, erectile difficulties can occur, infertility and impotence. Oftentimes, couples will come to therapy talking about arguments or problems with infertility, and I certainly think they need to have knowledge about and be able to ask their doctors. It's not for us to deal with as mental health clinicians, but it is for their physicians, and hopefully they're seeing the right kind of physicians that are very familiar with, and not just trying to sell them treatments that may or may not work. But that's a whole other issue. Delayed or early puberty. If anybody is working with children, young children, 7, 8 years old is very, very early, and that could indicate an endocrine disturbance that can happen in childhood. And a pituitary specialist or endocrine specialist who works with pituitary patients is very important These are not things for primary care. These are things that need to be referred to specialists for things that you're concerned about, potential serious issues. If there's any leakage from the breast, sometimes young girls particularly, or even older women, will not mention anything to their doctors. And so I think we can just ask about, in general, have you noticed anything unusual or difficulties or anything that leaks from your breast? And again, within establishing a good, safe relationship to help them understand that these are things that they need to talk, especially girls need to talk to their moms about, but also their doctors. Because it can be because of some psychiatric medications that can cause this. Certainly isn't, again, none of these symptoms in and of themselves. I don't want anybody to leave here saying, oh my gosh, I have a tumor in my brain, I better go and see a specialist, because these are tricky things, and it's more of the overall picture of lots of symptoms over a period of time. But each of these symptoms are significant, and they also can be life-altering. So if we're looking more at the psychological, emotional realm, we've got depression, very commonly associated with the disorders that I'll be talking about. Memory impairment, very common. Again, we may presume that we're dealing with only depression or only some kind of cognitive dysfunction of some sort, and forget that maybe sometimes there's a biological underpinning from some of these things that we deal with. Anxiety, very, very common. Mood swings, to the point, quite honestly, where I spoke a few years ago on a panel with a patient who was diagnosed. It took him years, many years, to get diagnosed. Went in and had pituitary neurosurgery. He had been diagnosed by a psychiatrist as having bipolar. All of his symptoms look bipolar. I absolutely will tell you that mood swings can be absolutely very significant. The next day after surgery, he did not have mood swings. So in some cases, it is really about, a little tiny growth up on the pituitary gland that can really majorly show some psychiatric, psychological difficulties. Anger, rage, irritability. My example is most people have heard about people who abuse steroids, anabolic steroids, and we know that people who do that can be very rageful, it can be very dangerous. Well, on the opposite end, most of us either are women or know of women who have gone through monthly PMS who might get a bit irritable. So it makes sense that the endocrine system has something to do with anger or rage or irritability. Again, not everybody that gets slightly irritable once a month is going to be needing to rush off to a doctor. And then we've got physical issues. Weight gain, weight loss. Now I'm talking about significant. For example, I have a friend actually that just got diagnosed with a disorder of one of these kinds, and tiny little person, very, very small, and her face has just been blowing up. She gets puffy, very, very puffy. But over a it's really fairly significant. I also know a lovely woman who's been an advocate for years, and she was, I think she says that she started off as a size 2 when she was an airline, back then it was called a stewardess, and she gained, I think, 50 pounds in a 2-month period of time, and she was not eating potato chips. Again, we want to take this into account of asking lots of questions. We want to go to 2nd, 3rd, and 4th level questions. How is your weight? Is it stable? Does it fluctuate? If it fluctuates, why? And you want to ask people, is their diet changing? Are they eating cookies and potato chips? Or if not, some of these people have gone on 900-calorie diets and they're still gaining weight. That's an endocrine disorder. And weight loss as well. Anybody who deals with the eating disorder population needs to be very aware that, again, sometimes not all weight loss is due to a cognitive desire to want to lose weight. Sometimes the weight loss is just happening, and then maybe there could be some cognitive changes as a result of that. But generally, you're going to look for whether they're really trying to lose weight or not. But a lot of times we see a very sick person and we're going to make judgment calls on that. And so I think it's just important that we're a little more open-minded. You might see some physical changes. There's a lot of different physical changes. Stretch marks on the body that are unusual, little skin tags, other kinds of just marks on the body that just seem to come up. Excessive hair growth. That's another thing. Particularly for women, you might see real dark hair along the chin line, and that's not good. Vision changes. This is very common for men particularly because a lot of times men don't go to the doctor as frequently as women tend to, and by the time they have peripheral vision abnormalities, it may be an indicator that a pituitary growth has gotten so big that it actually affects the optic nerves in the head because of where it's located, kind of between the eyes and back a little bit, and the optic nerves kind of cross right where the pituitary gland is. So that can be very serious and can lead to loss of vision. Amenorrhea, loss of menstrual cycle. Again, you want to ask history about that. Is it sudden? Is it gone over a period of time? You know, that sort of thing. Stretch marks I mentioned already. Carpal tunnel, particularly if it's bilateral. That is really significant. If it's unilateral, that's one thing, but if it's bilateral, that's a very common physical ramification. Fatigue. Again, fatigue in and of itself, I'm not going to say is indicative, but along with many of these other things, you're going to start asking a lot more questions. Headaches, I always, whenever I have a client who has headaches, I want to ask them, where do they start? Where do they typically occur in the head, and that they can show me. And then again, I don't want to presume it's migraine or whatever else. You want to kind of ask these questions, and then it helps them to go to their doctor, and you're helping them advocate for themselves by helping them delineate some of these symptoms that could be significant, as well as helping to calm their anxiety because you don't want to jump to any conclusions either. Sleep disturbances as well. There was an interesting study just recently, it was published in March of this year, with oxytocin as a promising treatment for anorexia. I thought was kind of very interesting. So again, it was delivered via a nasal spray, and it really affected the patients that they were looking at on their view of intake of food or not intake of food, as well as their body image. So I think, again, some of these things are very promising for research down the road. I'm going to make a little mention here of something called melancholic depression, which is not in the DSM-5, unfortunately. There's a book, a very fascinating book by Shorter and Fink that came out in 2010 that looks particularly at the psychiatric profession, and it's overlooking the endocrinology aspect of certain kinds of depression, which they call melancholic depression. Some of the hallmark symptoms are anxiety, loss of appetite, loss of sex drive, rapid heartbeat, high blood pressure, and high cholesterol and triglyceride levels. Having a higher than normal CRH is a corticotropin-releasing hormone. You don't need to know all that, but a higher than normal rate of that. Cortisol and TRH, which is thyroid-releasing hormone, have a close relationship with behavior, and so you'll see that with melancholic depression. And most people who are depressed, which is interesting, have high cortisol levels. Very interesting, if by chance they go in and they get their levels checked. And almost any psychiatric illness, such as even a mild one, can result in cortisol excess. Cortisol, again, comes from either pituitary and or the adrenal glands, is part of our stress system. So it kind of makes sense that our cortisol levels would be increased because of the stress. So if we're looking at quality of life, people that have any of these disorders that I'm talking about, where the pituitary or adrenal glands are off, I will tell you the significant decrease in quality of life is part of why I really felt compelled to need to educate people about this. I'm going to read just one brief thing. This was written to me in September 2006 from a wife who was married to a man who had one of these disorders. She says, I have to point out that when it comes to dealing with pituitary issues, it is really not just the patient, but the whole family, at least in my case. My kids and I have been struggling for over 15 years with the ups, downs, ins, and outs of the hormonal issues of my husband, and no one has ever told us of special counseling. His endocrinologist just blows it off as a marital issue. The issues, I might add, helped create 15 years ago when my husband first mentioned to him about all the ugly thoughts he was having after his surgery. No one believes the family as to what it's like to live with this. The only counseling that ever came close to addressing any of the issues was a brain trauma counseling at a local brain trauma center, but it only addressed the brain damage after 10 years of surgeries, sleep apnea, and not the hormonal issues. We are now back to dealing with him back on testosterone. I just have lots and lots of these stories. These are real people. These are just some of the real life accounts from people. And again, I have lots of these. I'll just read a couple of these. For 7 agonizing years, I desperately sought answers from the medical community for whatever the demon was that had literally taken over my entire quality of life, and I knew was surely going to kill me if I didn't get help. But unfortunately, I was told by multiple medical professionals that my laundry list of poor health issues were all in my head. Another one from Jesse. As I lived with this, it caused great anxiety. The label that best fit was panic attacks. Next comes bipolar, known to be chronic and lifelong, no cure. Either the diagnosis was wrong, or I may be the first person ever cured after having surgery. This is somebody who went in for surgery and no longer had these psychological illnesses afterwards. Another one from Janelle. I was depressed and anxious and sick and weak. Now I know why. Once declared healthy, Mom, my true patient advocate, called each doctor who told me I was merely depressed, anxious, and entering teen angst. Each was baffled to hear that I had a pituitary disorder rendering me useless. Some psychiatrists were appreciative. Others claimed that a pituitary adenoma had no effect on emotional well-being. Most of these people, by the way, have gone to multiple doctors, and on average it takes about 8 to 10 years to get a medical diagnosis, on average. I did meet one person who had a mom who was a nurse, and she got diagnosed after 4 years. I truly believe that we can be part of the solution and get people to get diagnosed earlier. And finally, I'm 37 years old and I've been ill most of my life. I read about symptoms of low testosterone. I had surgery to remove the tumor. I had very poor family life. All affection died. I have no social support system. My #1 issue now is my sexuality performance. How do I burst through this? And this is by a man I talked to in person. So some of the high-risk populations are those with traumatic brain injury. It's getting a lot of press in today's world for lots of reasons and new laws that are being established. And psychological trauma, post-traumatic stress disorder. A history of childhood trauma has been shown, particularly child abuse or with an abusive or alcoholic parent. Some very interesting studies that I cite in my book about that, that years later will then show up in a real biological illness. Eating disorders I've talked about already a little bit, and women postpartum. Sometimes their hormonal system gets so out of whack. This I wanted to bring up because it was fairly recent. In February, was published in the LA Times. And a doctor that I know of quite well, Dr. Daniel Kelly, for several years has been doing a study of retired NFL players. Very interesting study because of the rate of concussions within the NFL. I mean, it's a good population to study. And amongst many other things that obviously can happen. There has been a pretty strong correlation of pituitary tumors amongst these players. So I thought that this was kind of interesting, and again, it just indicates one of many studies that are being done in this realm. So what is this? Is this a chicken? Is it an egg? Is it both? What happens first? Is it the psychiatric symptoms? Is it the hormonal changes that happen? What do we do about all of this? I think I don't have all the answers, but I think that, to me, I think it's both. I think that they go hand in hand, and I don't think one has to know first or the second. I think that the mental health community needs to work more closely hand in hand with the psychiatric as well as with the medical community to be able to help people be identified. If we look at developmental psychobiology, we looked at maternal care within an attachment relationship helps shape the infant's HPA axis. This just indicates that even very, very early on, we talk about in today's world, and helping from a biological sense what happens when either that bond is very strong or when it isn't very strong, and it may actually affect biological process. The mother's emotional state influences developing brain. Hello?
Muted.
Hello? Oh, I'm hearing something. I don't know if everybody else is. And then the mother-infant attachment in another study by Shore. A lot of us are familiar with Alan Shore's work. And it can affect the development of the RH, and it can either influence and facilitate resilience to stress or create a predisposition to affect dysregulation. And then the scientific consensus is emerging that the origins of adult diseases are often found amongst developmental and biological disruptions occurring during the early years of life. So real important to recognize those early developmental issues. Regarding trauma and extreme stress on the endocrine system, a particular illness called Cushing's disease or disorder affects the production of cortisol. Cushing's is oftentimes seen as having some of the most extreme mental health symptoms. Way back in the 30s, there was a study of a Cushing's patient, and after 2 years, they looked pre and post. After 2 years, 1/3 of the Cushing's patients had died of suicide. If that gives any kind of indication to the extreme nature of how excess cortisol, what it can do to people, is really very, very dramatic. Luckily nowadays there are better treatments, and hopefully we can identify people again, but a lot of these people take many years to get a diagnosis. One of the consequences of exposure to trauma in an auto accident, for example, this is one case where he spoke, most of his patients had gained 10 to 20 pounds during the first few months after an accident, and there was no increase in caloric intake. So this is within a normal kind of range, seeing the impact on the endocrine system of trauma. Experiencing traumatic event alone obviously is not sufficient to produce an anatomical or physiological changes in the brain. It requires prolonged exposure to elevated cortisol levels that leads to a process called kindling in selected brain regions. It's like kindling, like a fire. It's like it's there, and it's kind of, and then all of a sudden, poosh, you know, the fire erupts. And so we are looking at prolonged trauma, not just a one-time event. And then when we look at adenomas, which is a very common one of these tumors that happens, one of these endocrine disorders, there's a lot of factors that occur that are psychological in nature. And Dr. Sonino did several studies where he saw that the results of their study showed stressful life events in the year before the first signs of the disease, before the doctors, the medical doctors, saw any signs of the disease, and they saw this, that they had significant losses, undesirable or uncontrolled events than the control group. So the medical studies are showing that there are significant trauma-related incidences that seem to predispose some people to these disorders. Back to Dr. Cushing, he also stated a physician is obligated to consider more than a diseased organ, more than even the whole man. He must view the man in his world. I think it's a very systemic perspective. Dr. Cushing is known by pretty much any doctor who goes through medical school. He worked at Johns Hopkins as well as Harvard, and he's considered one of the greatest neurosurgeons of the 20th century and a pioneer in his work. And Cushing's disease or illness is named after him. So any chronic or severe illness in the family system, obviously it affects the whole system. It affects the patient, the family, caretakers, whether they be family caretakers or out-of-family caretakers, medical doctors, psychiatrists, nurses, family therapists, psychologists, social workers. We really need to look at this as a broad spectrum effect on the whole family. And when we look at chronic or severe medical or mental illness, in general, on the left side, we're looking at any of those exacerbate existing family conflicts. We know that it disrupts the homeostatic balance. We know it changes roles within the family. Sometimes the person who was in charge is no longer capable, so that changes their roles. It could be a significant influence on family finances and whether somebody is able to work. A lot of the patients that I have talked with who've been affected by these things have lost their jobs, maybe because they're not physically able, but sometimes because they're emotionally, they've gotten more and more difficult to deal with. Their depression has caused them inability to be able, or their cognitive level diminishes. And so eventually they lose their jobs. Many of these people end up on disability or, you know, I think we probably, if we someday would have the ability to look at the prison system and some of the lower socioeconomic levels, we may find a significant number of people that are affected. The community support, the public versus private illness and community awareness really makes a difference. But if we look at specifically at pituitary or endocrine disorders, there is a history of improper or long-delayed medical diagnoses. It's an additional thing that people have to deal with. The number of doctors they go to, the number of people that tell them that it's all in their head or that they're just feigning this, it's just really significant. And so that really takes a toll. The ignorance of the prevalence and the impact and the significance on patients, family, social, work, all those systems, it's just astounding to me. And this is amongst the medical as well as the mental health community. This is just not known. Apathy. Apathy isn't talked about very much within mental health, but it is a significant symptom of some of these disorders. And by apathy, I think it keeps, and I hate to say this, if there is a terrible kind of view of what some of these patients are, very oftentimes these are 30-something-year-olds that are living in their parents' basement. They have no job, they don't go out very much, and they don't have much life. And they don't seek mental health treatment because they're flat. They're pretty much flat. They're apathetic. And so we may or may not come across them if it gets to that degree. And then, of course, the impact of anger and aggressive symptoms, again, on all the people around them, not just the patients themselves. And then just body issues. When somebody gains significant weight, when their facial features change, sometimes hands will change, feet, I mean, their entire body looks grotesque sometimes. It's huge. It's just huge for someone. So what is the role for mental health professionals? First of all, just anybody who's here listening to this, having an awareness of the problem. Asking the question is very important. Educating yourself as well as the client. You don't have to be a specialist in all of this, but being aware that something else could be going on and just walking clients through that, helping them to ask the questions of their doctors and be prepared for some negative responses, which is difficult. An openness to collaboration with the medical world, I think, is just really important. Us dealing with intimidation that happens oftentimes, as well as developing new methods of communication with the medical community. We have to learn to talk their language, and that's really important. We need to provide informed support for clients and helping clients as well as ourselves learn about the biopsychology of specific illnesses, of these as well as other ones, and keeping careful professional boundaries. Of course, we have boundaries of which we need to fall within our particular specialties, and that's important, yeah, absolutely. And at some point, developing research and new models for some of these specific populations. Within the medical family therapy field, I think there's some hopefulness there. Sometimes collaborative family therapy is also a term that's used, or integrative care. I would hope that there's going to be more research within the mental health community, not just medical, to find out what interventions might work with some of these people. Are there things that might be more helpful than other things? And to begin to write into our journals and to get published. I think that's really important. And so are we looking at the whole body or not? This one says, you say it's all in my head. So the rest of me is just out in joints and tendons. No, I think it's the whole body. I think the whole body needs to be looked at here. Here is one pituitary patient's wisdom that I just think is just lovely. She says, I have shared this with my friends, and now most of them are practicing, quote unquote, my princess moment ritual. After a long struggle with multiple symptoms that did not match what ladies my age were experiencing, I got diagnosed. Believe me, it was a relief to know that I was not going crazy and that menopause was not killing me. And she talked a little bit about her princess moment in taking a bath and doing a lot of self-care, nurturing kinds of things that I think is a lovely reframe, that this isn't about having an illness and, oh gosh, everything's terrible. We do have to help find resources for people and provide hope. Here's some resources that I'm hoping that could be helpful for you. My book is listed in there along with some organizations as well as website places that you may be able to find. So at this point, hopefully you have some questions, and I hope this has been useful information for you all.
Thank you so much, Linda. We thank you for taking your time to do this. It was an excellent and very informative presentation, and definitely something that I think we can use here and other professionals, mental health and medical professionals can use. So thank you so much. I'm waiting for questions to come in, so if anybody does have questions, please go ahead and enter them into the chat or the questions bar, and I will go ahead and give them to Linda. I think we have a question coming in, so we're almost, as soon as I get the question, I'll go ahead and ask it to Linda.
Okay. And I also want to thank Sovereign for your willingness to ask me to do this and open-mindedness to have a topic that's a little bit out of the box.
Well, I think it's me personally, I think it's a great awareness topic, so definitely thank you for thanking us. So nothing so far. I think the only question was about the PowerPoint, and to answer that, we will have, it was a great PowerPoint, and the PowerPoint as well as the quiz, that will be posted on our website. Everyone that's participating will be receiving an email to log into the website to take the quiz and receive your certificate for the CEU credit. And so along with that, the PowerPoint will be posted on that forum.
And also just one addition, I'm more than happy to consult with clinicians. You can contact me, email, linrio805 If you have concerns about a client that you're working with, or if you're, again, you're unsure of understanding, I've tried to pack a lot in here today, more than happy to consult with you, provide some guidance about, you know, how we might all work together.
Great, and actually we have several questions now, so the first,
right.
yeah, I see them. So the first question we have is from Karen, and she's asking, what should we do when MDs tell us or clients, or tell us or the clients, it's all in your head?
Good, an excellent question. One of the things that I highly encourage, and I've learned through my years of doing this and talking to lots of doctors and specialists worldwide, one of the things I have learned is that if you go to your local doctor and you get fixed, or they seem it works, that's fine. But if you have something that's out of the box, or if you keep going to a doctor and then another doctor and you're not getting any good answers, you need absolutely to go to a major metropolitan teaching hospital, because these are the areas where you're going to get the latest information and the most highly specialized people. I just can't emphasize that enough. And it's not just about endocrine disorders, but I think it's about a lot of medical things. It's just an important thing. And a lot of clients are reluctant to drive an hour, 2 hours, but I cannot tell you what a difference it makes, because I have heard stories, for example, of people who went and had pituitary neurosurgery by a doctor that did maybe 10 of these a year. Now, unless a doctor is doing 200 a year, you don't go inside somebody's head and operate on your brain without having such an extreme level of specialty. There's about 20 doctors in the country that can do this. So it's very highly specialized. And I think sometimes our role is to help really empower clients to have the ego strength to ask the question, to disagree with the doctors, and then also to say you need another opinion.
Excellent. Thank you for that answer. Karen also asks, so this is the same person, she also asks, how can we best self-care, or what is the best self-care?
Well, I think one of the things as clinicians, I think that one of the things that I have found is it's frustrating, quite honestly, to see the people that I work with sometimes get poor medical care. So I think that it has an effect on us as clinicians. And we also get affected by cortisol, so we also have to be aware of that. And we need to monitor that, first of all, we're not doing more work than the client is doing. That's good standard mental health care, as well as consulting. Consult. If you've got these tough kind of cases and if there's medical issues that are in there, I also think if you can get someone in your purview that's a medical person, even if it's a nurse, a doctor, someone that you can develop a relationship with, so you can ask questions, try to understand some of the medical terminology that sometimes clients will come in with. A lot of times these clients are going to come in really educated about, they understand a lot of this because it's happening to them. And so for us, I think then we need to understand at least the basics of what this means so that we can empathize with our clients and we can help them understand what they can do. So I think some of that is self-care as well.
Great. Thank you so much for answering that. Our next question comes from Stephen or Stefan. I apologize if I mispronounced the name. And his question is, what are the best labs to screen for pituitary adenomas?
Good question. I didn't put that slide on here. I do have a specific slide about that, but it's like for more advanced. There are, generally what I would say is they need to go to first of all, a reputable lab, because laboratories vary in their accuracy. There's been some studies about variances, and that's a little scary, but going to a good reputable lab, that's one thing. The other thing is, in most cases, you really want to make sure that your clients know that they should go, if they're getting blood drawn, get their blood drawn first thing in the morning on an empty stomach. It's amazing sometimes doctors forget to tell their patients to do that. Also, they're looking for probably a lot depends on what kind of symptoms they're showing. But in general, you're going to be looking at T3, T4, and TSH. Those are thyroid hormones that they're looking for. And prolactin is another one that you're going to look for, cortisol levels. Those are some of the basic ones. Cortisol is tricky because really to get a good reading, you need to take several readings throughout the day, and a lot of times doctors don't know this and even disagree with this, but some of the top specialists say, I have one doctor up in San Francisco who really knows his stuff, and he takes 7 samples in a 24-hour period of time. So, and some people would think that's excessive, but if you're really at the level of trying to differentiate and get a real accurate diagnosis, then that's what it takes. But a lot of it will be blood work. And then what I also would say is recommend to your clients to ask for the specific number, not just, oh, it's normal or you're okay. Sometimes the labs or the doctors will just call the clients and just say, oh, you're fine. No, I want to get my exact reading, because it helps empower the patient, and going back and forth between patient and client because it depends on whether it's medical or not. But the patient needs to be able to be empowered to watch, okay, so if 6 months from now my levels are different, I want to be tracking that and be noticing that. And also, if something's on the low normal or high normal, that still might be significant. And a lot of doctors don't know that part. That's a real specialty thing, and that's only in the last couple of years that they're really looking at. Those reference ranges aren't exact.
Great, thank you. That was very helpful. I think that's a lot of information. We're going back now. Karen, she asked a couple of questions earlier. She's asking another question, which is, what if we prefer alternative holistic methods, but traditional Western medical and insurance doesn't support or cover, for example, acupuncture, chiropractics, compounded meds, etc.?
Well, that's a big issue. I don't know that that's probably political, and that's probably beyond my skills or capacity. What I would say, though, is it's very important to recognize, I think all alternative medicines, certainly on the preventative level and certainly for self-care, are very important and is adjunctive. Be very helpful to encourage clients to do self-care and to do, particularly somebody, for example, who has Cushing's disease, they have to be very, very, very careful of keeping their stress levels low, because their bodies are really sensitive and it can cause so many problems if they, and that is by self-care, even after surgery or even with Western medicine medications. But it's also important to recognize if somebody has a growth in their body, and in a part of their body, I personally don't believe that anything other than probably surgery if it's indicated. And they've got amazing surgical procedures these days, just amazing, with really good rates of recovery fairly quickly. So I guess I would say that I think it has a place, but not instead of, and that's my personal opinion. I think we have to rely on some of the high-tech things that we have available to us today, and again, honoring the alternative methods as adjunctive.
Great, thank you for that answer. It looks like we have one last question, and this one is from Paula, and she's asking if the specialist that one seeks for the pituitary problems is an endocrinologist or a neurologist.
I would say that for these kinds of things, you're looking at an endocrinologist, but you have to be careful, because not all endocrinologists are real knowledgeable about something like pituitary tumors. A lot of endocrinologists are very, very good at diabetes and management, whatever, because there's a lot of that out there. So you really have to do your homework and find out. And I also would say, even with a specialist, you may want to get another opinion. You want to get a couple of opinions from specialists who specialize in the kind of disorder that you're looking at, because again, these are really highly specialized things.
Excellent. Thank you for answering all of the questions that we had come in. I believe that was the last one, unless we have any last-minute questions that come in. But again, we thank you so much for taking your time and, presenting on this subject that you're so passionate about. And we appreciate you answering all of the questions. So thank you so much, Linda.
Thank you all, too.
Great, and just to close it out, since that was the last question, again, if you have any questions for us, please contact us at C as in cat, EU at SOV, S-O-V as in Victor, health.com. If you have questions for Linda, her email is linrio805@gmail.com. Thank you so much for everyone's participation, and thank you, Linda, once again.